Good afternoon, and thank you for joining the RLS Foundation's webinar titled Non-Medication Options for Managing RLS. My name is Adriana Colucci, and I'm the Administrative Assistant here at the RLS Foundation. The RLS Foundation has been using a new webinar platform, Zoom Webinars, for this and all future webinar events. To ensure seamless webinar access, confirm that your Zoom app is up to date with the current software. If you need help accessing the live webinar on your computer, call the phone number listed on your registration confirmation email for assistance. If you have any other questions, please email clara@rls.org. Before we begin, please be aware that all attendees will remain on mute during this hour. We thank you for the questions submitted with your registration. The presenter will answer as many questions as time allows following the presentation. After the webinar, the recording will be made available in the member portal section of our website on the next business day. If you are not a Foundation member, and if you would like to view this and other recorded webinars, we invite you to become a member today by going to www.rls.org. As always, individuals suspecting they may have RLS should consult a qualified healthcare provider. The information offered in this webinar is for informational purposes and should not be considered as a substitute for the advice of a healthcare provider. Our speaker today is Dr. Jennifer Hensley. She is a certified nurse midwife and women's health nurse practitioner. She built her clinical scholarship on restless leg syndrome during pregnancy and sleep disorders in women across the lifespan. She is an active member of the RLS Foundation's Quality Care Certification and Medical Bulletin committees. Thank you, Dr. Hensley, for sharing your time and expertise with us today. I now invite you to begin your presentation.
Thank you, Adriana, and hello, everybody. I am hoping that this will be more of a fireside chat than a lecture to you. Hoping especially for the fireside chat because the holidays are coming up. And the holidays for some of us mean a lot of fun and getting together with family. But for others of us, it does mean that there may be more stress, either being alone or the stress of making certain that everything is prepared well and prepared correctly. And I'm sure all of the RLS sufferers who are listening know that any added stress, any surprises to your routine that upset that routine can certainly exacerbate symptoms. So there are a lot of slides and there is a handout. I don't know what Adriana and Clara will do with that, but it is available to you. All right, let's get started. Okay, first I'd like to thank everybody who has written any type of article for RLS before, including myself. But what I thought I would do is go back as far as I could in our night walkers and see what has evolved over the years written about complementary alternative modalities, methods, or treatments to treat RLS. So I have a list of persons who have written about this, and I want to thank them. And I'd like to thank those that I might have forgotten. So I started with all of these short, tiny little vignette articles. And then I went out and cast a wider net to see in the research if anything had changed over the years. For those who are new to RLS, very quickly, it is a sensory and a motor disorder. It is affected by iron deficiency and dysfunction in dopamine, which is a very important neurotransmitter in the brain. It does follow a 24-hour clock rhythm, and it follows what the body does with iron production and dopamine production, which is why the symptoms appear to get worse in the afternoon through the night and into the morning, and then abate in the morning. We know that it is in part genetic and it can be acquired, such as those who are iron deficient, chronic kidney disease, pregnancy. And it has exacerbations where things are worse and remissions where symptoms are gone. It is chronic, and we do know, and it's why you're here, that these symptoms adversely affect your sleep and quality of life. So I hope that I'm going to give you an arsenal of some things to use when you really need a rescue treatment. And it is a clinical diagnosis based on symptoms and a provider not being able to find anything else neurologically causing the symptoms. Well, here's the caveat, the bad news caveat. One, most of the treatments we're going to talk about today are not FDA approved. Okay. And most of them say they help manage RLS symptoms, not cure the symptoms. So for that, I'm hoping that you could take one or two things away that would work for you, that you can have in your back pocket for when the symptoms are really out of control. And sleep is particularly elusive. So I'm sorry if this is a humph moment, but I am hoping to offer you something. Now, here's the good news. When we talk about things being FDA approved, we're talking about drugs and biologicals. When we do randomized controlled trials, we're always looking for statistical significance. And what that means is, for the majority of the participants in the study, the intervention helped them or decreased symptoms. However, that does not account for clinical significance, which means even though it didn't work, it might work for you. Okay? So keep that in mind. Just because it doesn't work for one person doesn't mean it will not work for the other, and it might work for you. And let's not forget about placebo effect with any of this and all of it. Even the pharmaceuticals that we prescribe that are FDA approved. What is a placebo effect? And it's up to 40%. Your brain believes something is working because you told it it's working. So that's the mind over matter thing. And I have an example. This is years ago, but I was particularly wound up one night and I had bought a bottle of wine and someone was tired of me being so wound up and said, Jenny, just go have a glass of wine. So I poured myself a big glass of wine and I started to feel better. And I was going to pour a second one, but I knew I had to go to clinic in the morning and I didn't want to be hungover. Well, after I got home from clinic and I was putting the bottle away, I realized that it was non-alcoholic wine. So you tell me. I had convinced myself that I was having a large glass of wine, even though there was no alcohol in it. Okay, so placebo effect, in effect, works. The Food and Drug Administration is there to protect us and approve new human drugs and biologicals, but it does not approve everything. Things must be registered with it, and that's the difference. In order for something to go to sale on the market does not mean that it has to be FDA approved, but it should be registered with the FDA. And any compounded medications are not FDA approved. So what does the FDA not approve? And this is where it becomes important. Medical foods, dietary supplements, which we're going to talk about, food labels, those nice nutritional and supplement fact labels that we have. And as important, or if not more important, I think the structure function claims. Maybe you've seen on the side of a magnesium bottle or any other supplement, after 1 week of use, your RLS will be cured. Well, probably not, and it's not FDA approved. So let's go first things first, and I'm going to go quickly because you can either listen to this again or you can read the notes. So first things first, make certain that you have been to your healthcare provider to diagnose and address any medical disorders that might contribute to iron deficiency, since we unequivocally know that iron deficiency exacerbates RLS symptoms. At a minimum, ask for a ferritin check along with a complete blood count. If you have a suspicion that you have a malabsorption syndrome, you can start with checking for celiac disease by a blood test. Of course, in order to determine whether or not you really have this, you're going to need a biopsy. But first things first. And then if you are losing blood or if you are anemic, let's find out why and correct that. Example, we know unequivocally that those with chronic kidney disease are not going to produce the hormone erythropoietin as they should, and that is going to lead to anemia. The anemia is going to lead to less iron that crosses into the brain. That's going to mean less production of dopamine, and the RLS symptoms will get worse. So please see your healthcare provider. Make certain that any iron deficiency has been taken care of. The next step would be to diagnose and address any other sleep disorders that might either make RLS worse or confuse the picture. And I can only tell you what's recommended, not what I do, but we should all be committing to sleep hygiene 24/7, 365. I'm sorry, that's my dog. Routine, routine, routine. To bed at the same time, up at the same time. If you're not asleep in 30 minutes, get up and do something boring until you're tired and then go back to bed. And maybe some of you have heard of the 10-3-2-1-0 rule. No caffeine 10 hours ahead of time before you go to bed. No food or alcohol 3 hours before. No work 2 hours before. No TikTok or screen time an hour before. And no hitting of the snooze alarm in the morning. This is all part of retraining your brain, which we will touch on when we talk about RLS and insomnia. Avoid triggers. And I put this slide in here because the holidays are coming up. One thing that, or a few things that are high on the list would be intake of refined sugar, salt, chocolate, caffeine, and alcohol, if I didn't already say that. Those of you who are RLS sufferers know certain medications that will antagonize your dopamine and possibly make the symptoms worse. And other things, if you're traveling, changes in medication manufacturers, those long car rides, etc. Also watch your diet, and this goes along with triggers as well. Also make certain that you get enough minerals and vitamins. And when you see your PCP at the annual visit, I don't think there's any harm in having your B12 and folic acid, vitamin D checked. It's pretty hard to check magnesium. You might just want to get a supplement. We'll talk in a second. Now, Hoffman is one of our RLS members, and she wrote a very nice summary of how she managed her RLS symptoms in Night Walkers of Summer 2020. And because of her food allergies, etc., that no one had previously diagnosed, once she went on a plant-based anti-inflammatory diet, her RLS symptoms became very manageable. So this is a process. And watching your diet so that you maintain an optimal health. We know that obesity is an inflammatory condition, and inflammatory conditions affect your blood vessels. There's more endothelial damage, fewer dopamine receptors, and more iron deficiency. Just a second. I'm sorry, he was dreaming. Okay, so maintaining a healthy weight is essential for life and living, and management of comorbidities, hypertension, cardiac disease, diabetes, but it's also important for RLS management. Exercise. I think I looked at 20 articles, and some say 30 a day, 45 a day, 60 a day. How about we start with something that everybody is promoting right now? If possible, 6,000 steps a day. Okay? But not before bedtime. And when you travel well with RLS. And we do have in our publications how to travel with RLS, pregnancy and RLS. I invite you to go into the publications and look for a lot of information. But don't forget, when you're traveling these holidays, to prepare for your RLS. Reduce stress and anxiety. My Aunt Donna had RLS. First, I couldn't take her, could not get her to take any medication because she was against medication. And when I tried to get her to manage her stress and anxiety, and she was in her 80s, she just could not say no. She lived around the corner from the church, and the church just kept saying, ask Donna, ask Donna, ask Donna. I said, Aunt Donna, exercise your no muscle. Just say no, and then you can sleep at night. Your symptoms will be less, etc., etc. But to her, letting anybody down was worse than the symptoms of her RLS. So I'm giving you permission to say no if you need to say no in order to manage your symptoms. Now let's talk about CAMs, or complementary alternative methods, and put some things in your back pocket. One, they all take time to show benefit. The herbal preparations may take up to 3 months and need to be used consistently. Most, if any, are not covered by insurance and can be quite costly. And we cannot exclude placebo effect. But remember, don't go, oh, it's just placebo effect. Go, yes, placebo is working for me, just like my non-alcoholic wine did. All right, this is a very busy slide. And when I cast a wide net and looked at the most recent literature for everything, I ended up with 2 very good reviews. One was a systematic analysis, and the other one was just cast a wide net. But I put them into 2 categories. One where you can do things yourself, and the other where you're going to need a trained clinician. So let's look at what you can do first. Exercise. You could, if there's no contraindication medically for you to use a pneumatic compression device, you could do that, or near infrared light, traction straight leg raise. That's, you're just making your leg, you can see me in the corner, you keep your leg straight and you're stretching the muscle. Cryotherapy, I have a picture of somebody jumping into frigid water. Yoga, targeted pressure on your foot, reflexology and stretching. Now, the other things cost a lot of money and really need someone who knows what they're doing. The transcranial direct current stimulation, the repetitive transcranial magnetic stimulation, and the transspinal direct current stimulation plus acupuncture. These have been shown to be effective, statistically significant. So everything here works if you work it or you have the means and the money to pay for this. And the transcranial stimulations work for RLS, may not be covered because they're not indicated for RLS, but maybe if you're depressed and have RLS, they will be covered. And I had a faculty member who, for profound depression after the loss of her father, went and did the transcranial stimulation, and it helped, did not cure, but significantly improved the mood. And she would do it again, although she thought it was uncomfortable when the incorrect area of her brain was stimulated. And this is all with a cap on your head. It's not internal. Nobody's probing your brain. Just wanted to throw that out there. All right, so here we have some transcranial stimulation on our left. Here we have cryotherapy, whole body, WB cryotherapy. Yes, just jump right into that freezing water. And here we have a stimulation of the hallux. It's an acupressure point. You could get some pain, but it is statistically significant with regards to reducing RLS symptoms. So how do they work? Well, some are going to strengthen your immune system. Some are going to correct the deficiencies in minerals and vitamins you need to make your neurotransmitters. Some will reduce stress. Some will disrupt electrical and chemical signals either in a particular area or in the brain. Some will confuse your pain threshold so that it doesn't feel the pain. It feels whatever you're doing. Some will open up your blood vessels, and some will distract the brain. Now, the next question to ask is, what works for me? If you do not like fragrances and they make you sneeze, as they do for me, perhaps essential oils are not for you. If you don't like needles, perhaps acupuncture is not for you. So herbals, and this ties in with going to a naturopath or a homeopath. I'm not going to pretend to be an herbologist because the way they're grown and their potency will differ even within the same brand because of minerals in the soil, a drought condition, etc., and manufacturing differences. What's important is that you find a provider who will listen just to you and get some herbals just for you that work for you and not an entire huge group of people. You. And you need a one-on-one relationship, I think, to do that. Now, one thing that's very important is that sometimes things just stop working because we age, our receptors are saturated, the body gets used to it, etc. So herbals and any of our medications over time can stop working. Now, here's the number one question. Can we use medical cannabis? Is it a drug or an herb or what is it? And first of all, we need to look at what state you're living in. Any state that happens to be in the gray here, you're probably not going to find a whole lot of people willing to approve use of medical cannabis for restless leg symptoms. Now let's go on for a second. More kind of bad news. If you're hoping to try this, The American Academy of Neurology currently does not support the use of cannabis for neurologic disorders. Now, as I went through all of our night walkers back from 2015 up until the most recent, Dr. Bainbridge and Buchfer have, and Adriana Colucci put together information about medical cannabis as it keeps evolving and becomes legal in more and more states. So let's, just as a little background, our body produces endocannabinoids, and cannabis sativa works on those receptors within our brain, and it blocks the pain pathway. We know THC is psychoactive and the CBD is not. If you elect to use this, know that inhalation and vaporization is more effective for RLS symptoms than chewables. It's effective for 1 to 2 hours. And this is based on observational studies and not randomized controlled trials. So for many persons, it does work. And it is not legal in Texas, and I cannot talk about it. And here are some references from Nightwalkers 2023 if you'd like more information. So if you can't put medical cannabis in your back pocket, what about St. John's wort? And it was actually statistically significantly effective in treating RLS after 12 weeks of use. Now, one of the caveats to this study is that there was no control group. Okay, the participants were measured against their own before and after. Now, if you are going to use it, it should be 250 2 or 3 times a day, working up to 300 3 times a day. It does increase serotonin, dopamine, and norepinephrine, so it increases the dopamine. That could help with RLS symptoms. And it has many drug-to-drug interactions. So before you start St. John's wort, do have a conversation with your primary care doctor or your sleep expert to make certain that all the medications will neither be elevated in your body or ineffective in your body. And one thing to confuse the public a whole lot, I just went to Google and wanted to see how many hits for St. John's wort I got, and a lot of manufacturers. Melatonin is probably not the best for RLS. It suppresses dopamine. It can help with sleep onset in low doses. And if we want to phase somebody, which means get them to start sleeping at a different time consecutively, we might want to use higher doses. But overall, if it is for RLS symptoms, not going to work. And if you are taking it right now, please don't stop cold turkey, even though it is Thanksgiving. Taper off. What about magnesium? Magnesium has been shown to work for leg cramps, and it's cheap. It's if 250 milligrams are taken, it's probably not at all toxic, and it could be very, very helpful. If you are going to try magnesium, and it will take time for it to take effect, do get the salt that's aspartate, citrate, lactate, or chloride, because it is better absorbed. So I went into the bathroom and looked at what type of salt I buy, because I buy everything at the lowest unit package price. And well, mine is magnesium sulfate. So chances are really good that it just goes right through my gut and out. I might have to actually spend a little bit more money to get a better absorbed salt. But this would most certainly be worth a try. essential oils. Lavender is probably the best known. And I thought, well, what would I tell you all about getting, where would we get the best lavender? I mean, you can get a starter kit off Amazon. I don't know if I'm lucky or unlucky, but you open up one of these bottles, I'm going to start sneezing. I don't think they're true allergies. I just think that, essential oils are not for me, but they actually can work. And if you look here at Oshvandi's study, foot massage with lavender 3 times per week, and this was for dialysis patients whom we know have low iron. There was a statistically significant decrease in RLS symptoms and an increase in sleep. Now, I cannot imagine how we couldn't take this data and at least try it on a group of RLS sufferers who do not have chronic kidney disease. What you could do is ask a family member to learn how to massage your foot on another slide and to do it with lavender oil and try it and see if you do sleep better. I'm thinking if anybody rubbed my feet 3 times a week, I for sure would sleep better because it is so relaxing. We do have lotions, creams, and scrubs, and yes, menthol works because it's a counter irritant and it gives that cold feeling and it draws the attention away from the RLS symptoms. And this may be something that works during the holidays when you're really stressed out and the RLS is bad, and this could be your emergency go-to. When we manage asthma, we manage with steroidal inhalers. But if there's a bad exacerbation, we have the rescue inhaler, right? Well, maybe this could be your rescue treatment. Do watch out, however, for skin irritation or even a chemical burn. Baths and soaks do work, whether they're warm or cold. There was a study for fibromyalgia, not RLS, but I don't see why it couldn't work on the same principle for some in Orense, Spain. And since we can't all hop on a plane, which wouldn't be good for RLS sufferers anyway, and go over to Orense, I was trying to figure out how you could create the same bath at home. And the National Academy of Sciences recommends a water temperature in your bathtub of 92 to 100 degrees Celsius with Epsom salts. To be used only occasionally, so like not nightly, and just with a warning that magnesium might contribute to insulin resistance in those with diabetes. I really like naturopaths because they know a whole lot of things I do not know. And I'm going to encourage you to find a naturopath that you can bond with if this is the way you want to go for natural management of your RLS. They will tailor the treatment to you and map your particular triggers. This will take time and it will take money because every state that I have lived in, medical insurances have not covered naturopathic physicians. Homeopathy is another out-of-pocket but very important option if you want to go medication-free. On the right-hand side, you can find a practitioner near you and one that's certified. And homeopathy is built on, again, individualized treatment. Now, when you come into my office, I do listen to you as an individual, but I am here to tell you that I will practice based on the guidelines of the best evidence that reveals statistical significance. So I will tailor that and individualize it to you, but it's still kind of a one size fits all kind of thing, because this is what we know works. And I was not educated to go out and try something more natural, etc. We need both, right? Well, full circle, get all of the individuals. So you might want to consider looking into homeopathy. Reflexology, you can learn. Actually, you can learn online, and you can get a family member to do the reflexology and maybe even throw in a little bit of lavender essential oil. So you're applying pressure to specific reflex points on the feet, which are going to provoke your nervous system and endocrine system, and you're going to get a boost of serotonin and endorphins, etc. So even though the patients in Ghassemi's study were on dialysis, they still had RLS, and their severe symptoms became less. So maybe for Christmas, you give somebody, here, you're going to go learn reflexology for me certificate. Just a thought. Acupuncture and acupressure. Acupuncture, of course, needs a clinician that is trained to do this. Now, there's one study that I found, and it did show that acupuncture helped in the treatment of RLS, but these participants were also on gabapentin. We don't want to do acupuncture on anyone who has a clotting disorder or is on hemodialysis, because we don't want to either evoke a bleeding episode or introduce infection. But acupressure as well is also effective. And again, this is hemodialysis patients, but I really don't see why it wouldn't work for healthier patients that don't have chronic kidney disease. Anyway, if needles are not for you, perhaps acupressure would help. And it's not the same as reflexology, but family members can be trained. Dry needling, you do need to be a healthcare professional. It is a little bit different than acupuncture. It is still a hair fine needle, and it's more so to get to trigger points. But if your legs are all up in knots, I'm wondering, although there is no evidence, please hear me, no evidence, I couldn't find an article on this. I don't know whether or not this would be helpful for RLS. I'm just throwing it out there because I cast a wide net, because I wanted to have as many choices as possible for you, because some of you will say, that's not for me, and others will say, absolutely, that's for me. Yoga. I have arthritis, and so I'm throwing out a challenge to you. I keep telling myself, I can't do yoga because of my arthritis. Well, the easiest first pose I learned just recently that you can do is the mountain pose, and it's just standing still, straight up and down. But what you do have to do is make certain that all of this is incorporated into your pose, which takes a lot of mindfulness, thinking about what you're doing. So yoga is effective in decreasing RLS scores based on questionnaire studies. Okay, let's do it together this new year. Massage, we know, works. It releases endorphins, it improves blood flow, and a nice massage or effleurage. Effleurage is that very light stroking, disrupts pain signals going to the brain. So massage works, and you may want to find a qualified masseuse for you and have the same one either come into your home weekly or you go there weekly, one with malpractice who keeps your health record at hand. For insomnia, the one thing that has shown to work consistently is cognitive behavioral therapy. It's not easy. It takes commitment, and your sleep is going to get worse before it gets better. But you can now do it. You can now learn by yourself online, in person with a therapist, via telehealth, or in person. So cognitively, we want to retrain how you think. The bed is only for sex and sleep and nothing else. And you don't sleep anywhere else in the house. No naps. You just let that adenosine that's going to help you fall asleep build up. Behaviorally, you do the same sleep hygiene day after day after day. And sleep restriction may be necessary in order to help you learn to sleep well again. And that means you go to bed at the same time, get up at the same time, period, until you are sleeping well, and then you can sleep a little bit longer. Guided meditation. If you are a little OCDE like me, you want to breathe properly, and that can be annoying. But with all the guided meditation that's online right now, there has to be something that will work for you. And let's give ourselves permission to say, it's not about how perfectly I breathe, but that I am listening and breathing slowly so that I can recenter myself, because we know it works. And mindfulness, I'll just mention, I moved from Denver to Nashville. Culture shock. Had it not been for taking a mindfulness class and forcing myself to just listen to the moderator's voice 20 minutes a day, I don't know that I would have survived that culture shock. So it works for many things, and you can take it with you anywhere. We know technology engages the mind, and that works. Bob Waterman was very involved in the RLSF, the foundation. And he wrote a very nice article. And these are his 3 rules to live by: hands occupied, brain engaged, RLS in check. In the movies, he ate 1 popcorn kernel at a time. He was an artist. He could also knit and tie fishing lines, which kept his mind active. And he would exercise, or he would watch TV on the exercise bike because his legs kept going. And if a warm bath didn't work, then he would take a cold bath. Now, art therapy itself is not researched, but we do know anecdotally that it works because it engages the mind. Pneumatic compression devices work by, like the venous pump. If you were to stand up and flex your legs, bring your foot to your buttock, you'd be bringing the blood and lymphatics back towards your heart. And that is what pneumatic compression devices do. We also put them on you in the hospital to prevent blood clots when you go in for surgery. Going online, these devices are anywhere from $89 to $900. There are plenty of just compression stockings, not the device, the air device that blows up and then relaxes, blows up and relaxes. And many of the compression stockings say relief from RLS in 10 seconds. Well, I doubt that that's true, but putting on compression stockings could help. in an emergency situation. And you can get full leg PCDs, or you can get just a foot wrap. The vibration device, which I thought would be really good, is no longer being manufactured because the Center for Medicare Services ruled it was a pleasure device. So our Relaxis is no longer on the market. A TENS unit might work, and there are instructions that you need to pay attention to if you buy this on Amazon. But if you went to physical therapy, they might actually show you the best place to put it on, but then you'd have to pay for physical therapy. It is an electrical current that helps block pain signals and release some endorphins. However, I don't like the feeling, but many people do. And as a woman's health expert, we use it in labor for the pain of labor. So this is something that you might think of, not to cure your RLS, but something to have on hand for an emergency situation, blocking the pain signals. Okay, and we are almost done. The Beamer pulsed electromagnetic field temporarily increases the local blood circulation in healthy muscles. And you can see her sitting on, laying on the Beamer pad, which might be very helpful for RLS. But please note, healthy muscles. I can't get in and find out whether or not insurance has covered this or how much it costs out of pocket, because you have to create a profile and answer a lot of questions. But if you have not heard of this, it is something that might be useful. Near infrared causes vasodilation by stimulating the very inside of the blood vessel, the endothelium. And we know that vasodilation can help blood flow, and that will decrease RLS symptoms. You can get a near-infrared device for varying amounts of money, depending upon how large of a unit you want. And if this sounds attractive to you, I would encourage you to do some more Googling on it and see what comes up. Nidra, and this was one of your questions, the Nidra device is intended to reduce symptoms of RLS. And what it does is stimulate the perineal nerve. You can see the distribution of the perineal nerve here. Oh, sorry. And it activates the muscles to mimic the sensation of movement. So that, and we know that when you get up and walk around, the RLS symptoms do get better. So this is how it works. It alleviates the discomfort. Again, I could not get in to see how much this costs and whether or not insurances would pay for it. It's pretty new on the market, just FDA registered, etc. If you are interested, I would strongly encourage you to do some more diving into this. If we're just going to stimulate the perineal nerve, if you look at the oval down here, if you're traveling, these two little devices would be easily transportable. And I'm not certain if you were flying what the airport would say about it when we go through security checks, but definitely you wouldn't be lugging along huge equipment. Things coming up would be Botox. Right now, it's used for a whole lot of things, including spasms, you know, when your eye twitches. I'm assuming that's not just when you're tired, but when it like twitches 24/7. But there aren't, at this point, it's not FDA approved for RLS. And I can't recommend anyone who is doing any Botox for RLS right at this second, but probably later and on the horizon. And then there's also adenosine. Many of you know Starbucks coffee as our adenosine antagonist to help keep us awake. Well, we know that it could actually, at this point, help with RLS symptoms. First, we need to consider what to do about the side effects and do some more randomized control trials. But very exciting, 2 medication-ish type things on the horizon. And one thing that helps me sleep at night, takes my mind off of things, and maybe you have or have not heard of it, but it's ASMR. It's all over YouTube, and it's autonomous sensory meridian response. Who knows whether it's visual or auditory or both? Have you ever been sitting listening to somebody speak and you get a tingling feeling running across your scalp and down your spine? That is ASMR. There's just something so appealing that you get the tingles. Well, there's no research on it. I'm calling it something for emergency that you can put in your back pocket. Most of it's free on YouTube, and all you have to do is put on in the search box ASMR. Well, I ran through a whole lot of things that I'm hoping will help you over the holidays as an emergency. Maybe the next time you're in the grocery store, you could pick up a cooling pad, or you could pick up some Vicks Vapor Rub for menthol, or you could just put an itsy bitsy teensy bottle of magnesium in your suitcase, just in case, and you can pack your to-go RLS bag and pack some good foods and watch what you eat and get as many foot massages as you can, with or without lavender or peppermint oil or anything else. And I certainly hope that this helps. And this is Trebian that you see right here. And I hope that your holidays are Trebian.
Thank you so much for your wonderful webinar, Dr. Hensley. We're just going to jump into a few quick questions that were submitted during the registration process. So the first one is the consumption of tonic water and or magnesium suitable for mild symptoms of RLS?
I'm hoping that I answered the magnesium question, but both quinine and magnesium, in the few studies that are ancient, like as old as me, and that have been done, were actually looked at for leg cramps, so muscle cramps. And quinine is effective for leg cramps, and magnesium as well. Quinine in small amounts is safe. Quinine, however, as a medication was taken off the US market because it's a lethal drug taken in high amounts that can damage your kidneys, heart, and liver. So if I don't see any reason why not to try a small amount of tonic water, do be aware that if it's Schweppes, there's sugar in it. Sugar might be a trigger for some. If you get the low-cal Schweppes, well, that has aspartame in it. So that's a sugar substitute, which may trigger some very sensitive persons. So quinine as a medication is not available in the United States, but in small quantities, it should be safe to take unless you have a cardiac disorder.
Why is it that when I'm really tired, my legs seem to be more restless and it is not easy to calm them?
Anytime there is a sleep deficit, more stress, more anxiety, etc., you will have more of a fight or flight reaction. Your sympathetic nervous system will be on alert. Your epinephrine, norepinephrine will be surging through your body, and it will be more difficult to calm yourself down and harder to manage the RLS symptoms. In that case, some mindfulness may be the best, truly, because the breathing will help to lower your heart rate, shed some of that excess stress. This is where things that even I am resistant to make me want to say, I wish I had learned some yoga poses. I know how to breathe. I know how to relax from my toes all the way up to my head. And those things we know do work. I might want to ask you to try that. And there's everything online that you want and on your phone to guide you through it on a YouTube. Trust me, there's so much out there.
Has anyone looked at the effects of sex on reducing RLS symptoms? I find that it provides some temporary relief.
Absolutely. And anytime we have an orgasm, we get endorphins and dopamine, the feel-good drug, and oxytocin, and all the chemicals in our brain with relaxation and some vasodilation, because we actually get a sex flush that crawls up our chest and our face vasodilates. You get a little flush. So there's a little bit better blood flow, gets the heart working, etc. The problem is that it's temporary. So you got to go back and have some more sex, which I hope isn't a problem.
And then last question here. Why do mindfulness activities seem to work?
Two reasons, probably more. One, it takes your mind off of the offending symptoms. And secondly, when you take a deep breath in and relax your muscles, you are actively overriding your sympathetic nervous system and helping yourself into a state of calm. When you are calm, your blood flow will be better. You will, yeah, I'm going to just stop with that. Of course,
Well,
it's not easy to achieve, right? Yeah.
absolutely, absolutely. Well, thank you so much for joining us, and thank you to everybody who attended today's webinar. You can visit www.rls.org to view our upcoming events, and we hope you have a great day.
Could I just throw in, I did do a talk on hormones and RLS, and for that question, I'm going to refer you please to that webinar that I did, and I hope it helps.
And if you need help accessing that, you can email Clara at RLS or info@rls.org. Thank you.
Bye.